are the treatments for bowel cancer? And if there are multiple treatments, which one did you prefer and why?
There are a number of treatments they do, surgery being the main one, and chemotherapy and radiation as others. There's a lot of criteria and how they work out which is best for you. For me, the first one was surgery on my bowel, removing part of my large intestine and my small intestines. After that, I had 3 months of chemotherapy to try and shrink the tumours in my liver. Then I had 1/3 of my liver removed, followed by another 4 months of chemotherapy. I preferred the surgeries over chemotherapy any day.
What can you do to alleviate some of the numbness that is a side effect from chemotherapy?
Yeah, numbness, tingling on the extremities. It's a big side effect of chemotherapy. They do have some drugs they can give you to help alleviate it, but then there's other side effects that come with those drugs. For me, they started making me emotional, but time is really the only thing that helps heal your nerves. For me, it took almost 12 months to get rid of all the pain I had in my fingers. It didn't take too long after finishing chemotherapy for the effects in my throat to go away. I could not have things cold drink. It would feel like glass going down my throat. And the fingers and feet were the worst affected and took the longest to come right.
Is having radiation before having chemo a higher success rate, and why?
I don't know the answer to that one. There's so many things that determine what's the best treatment, and cancer is not the same for everyone. It changes. So one treatment for me might not be the right one for someone else. It all just depends on what the doctors find in your cancer.
Does having excessive abdominal fluid removed help a patient with bowel cancer?
Yes. The reason is that fluid's building up inside you and it's causing tightness. It can cause a lot of pain, which I had in my early part of my journey with bowel cancer, and having that drain can just alleviate the tightness and pressure that it puts on you.
How does a bowel cancer patient know what help to ask for when their medical professionals don't let them know what's available?
I think one of the best things you can do as you go through the journey of bowel cancer is to research and understand things yourself. A lot of the times the doctors will just give you recommendations, but you as the patient always have the final say on what treatment it is you have. And there's times where they gave me multiple options and I was looking to them to tell me which is the best one to have, but they will always put it back in my court and say it's up to you. And so I found over my 4 years journey that I needed to upskill myself in understanding some of these things, even the technical terms they use, because it helped me make more informed decisions about my own treatments.
When a bowel cancer patient is in the latter stages, say 3 or 4, and breathing is a struggle, should that patient be offered support like oxygen?
Okay, I'm in late stage for the tumours, multiple tumours in my left lung and in my chest and heart. But I'm not at the stage where I'm having difficulty breathing yet. One of the things I have learned in the last 4 years is sometimes you have to really push for things you need if you don't feel like you're not getting it. And that could mean going to another specialist to check. Some of the nurses are brilliant. They have a closer connection with their patients than some of the doctors do, which you only see for like 10-20 minutes. And they have some really good advice and can help push things along as well.